Hello, everybody. We're gonna start really, really soon. We have a very special guest, a very, very special guest. Super excited. Actually, we're just chatting it up before you all got here, but super excited to see every single one of you all. This is a really good topic, really, just really good topic. Because Lord knows,
Perfect for hump day today, too. Perfect topic.
right? Perfect for hump day, okay? Perfect for hump day. I've literally been getting my life together, but so as we're waiting for everybody to come in, we just want everybody to text, put in the chat where you're from, what city you're from, how excited you are to know all of this good information. Because I'm not gonna lie, Dr. Standifer, she got the tea that we need. Okay, she got the tea. She has the tea from so many different experiences, back personal experience, medical experience. Like she knows what she's talking about. Okay. So
Yep.
I want y'all to put in where y'all from. I want y'all to put in like how excited you are. Also, make sure you put your questions in there too, because we do have pre-submitted questions as well. But also we do want you all to ask questions in the chat because you never know. We're also gonna make sure we try to answer as many questions in the chat as possible. So make sure you all are getting all the information, getting everything that you need and more. Okay. So yes, I'm very excited. I've also been on my weight loss and just maintaining a healthy overall self. So, and I'm trying to get, I have a goal by summer. That's usually the case. But they say summer bodies are made in the winter. It's cold now, but by the time it's summertime outside, it's warm, you know, So yeah, I want y'all to tell us where you are in the city. Okay, I see Houston, Columbus, Ohio. I see Miami. Okay.
Miami, Florida. Look,
Miami.
they weather better than ours, Jess.
It's this cold. Oh my gosh. I'm seeing Los Angeles. Hey, Chicago. Hello. Hello, Chicago. I'm
Harlem,
seeing
let's get it.
Carolina. I'm seeing Memphis. I'm seeing Covington, Georgia. I'm seeing Columbia, South Carolina. I am seeing Memphis, Tennessee. Where else am I seeing? Okay, hello. Yeah, I'm excited, y'all. I'm so excited. If you don't know, if you can't tell my excitement, I'm excited. I've been on this trying to keep up with my fitness and health and just overall for the past like 3, 4 years. Okay, so I think this is where the breakthrough comes in, This is where the breakthrough comes in.
I'm ready to just, talk about it, dispel some myths, get some people inspired. We can get
Okay,
it.
definitely dispelling some myths. Okay, definitely dispelling some myths. I'm seeing Harrisburg, North Carolina, Orlando.
Very nice.
Okay, man, I just can't wait for the summer because this cold is not doing it.
You know what? It wasn't that bad. I looked. Wasn't it like 30, 40 degrees in
Yeah,
Chicago?
that's a cool. You feel me? That's cool.
That's cool.
Usually we always get like a negative, like I think last year or like 2 years ago we had like a -40. So I'm just like, if we can keep it. I see you, Bronx, Boogie Down Bronx. I see you. I see you. Yes. So usually we get like a -40, but hopefully, this year.
Listen.
Because honestly, it hits you January, February, and March. January and February is actually the coldest months in Chicago. Don't let December and November fool you. It's January and February.
And that wind chill that y'all have. Oh my gosh.
It's- hmm. The wind chill is actually very serious. The wind chill is actually very serious, okay? Very, very serious. But yes, y'all. Okay, we're gonna give it a couple of seconds before we start and introduce Dr. Standifer. Like I said, you can see by my excitement, we're gonna have a good information. We're gonna talk, we're gonna chat, we're gonna get some good details. We're gonna get some good, surprises at the end. We're gonna get some good information. Actually, I have my notebook as well with me here too, just to make sure, we up and we ready. Okay. I'm giving just we're gonna wait until it hits the all right. Oh five. We got it. All right, y'all. Well, welcome in. I'm super excited that you guys are all here, that you took this Wednesday after. well, evening to be here with us, to chat with us, and just know more about transforming our just health and our weight plate by plate. And just we're here with just an amazing guest. If you didn't know, my name is Jessica, part of Black Girl Vitamins team. If you are at any events, you'll see me. That's number one. But also, I'm just here to also just be here and have a conversation with Dr. Standifer. So I'm gonna let her just introduce herself. I want y'all to really listen in because, like I said, she really has like all the information that's necessary for something like this. Like she'll tell you everything. But yes, go ahead, Dr. Standifer.
Hey everybody. First off, thank you so much for being here on a Wednesday. I'm sure some people work, whatever have you, probably got kids running around in the background. We gonna make this as easy and just open as possible. So I'm Dr. Standifer-Barrett. I'm a medical advisor here at Black Girl Vitamins. I'm a board certified internal medicine physician, and I'm also a clinical professor for the College of Human Medicine at Michigan State University. I love all things medicine, hence being internal medicine. And one of the things I talk to the patients I take care of a lot is weight. And weight is one of those things that starts with the plate. So I'm so happy to get into it today.
All righty. So we're gonna have you talk about your personal experience, okay? Because I think it's always important to hear like what you've been through and how you're able to overcome or get through that. So, Dr. Stanford, go ahead and talk about your personal experience.
Yeah, so I'm Dr. Standifer, but I'm also a mom. I'm a mom, I'm a wife, so all the other things everybody else has too. As you can see in this picture was taken at my son's first birthday. He was 1 year old here, and this was in about 2022, as you can see from the labs. So in this picture, I actually was dealing with some back pain, really bad back pain. And like most doctors, I'm not the best with seeing a doctor sometimes, or I used to not be the best with that. I used to prioritize everybody else's care, my kids, my family, my patients over myself. And so I go to the doctor one day. Mind you, before going, I never had any medical conditions, nothing like that. And when I went, my blood pressure was 136 over 90. Normal blood pressure is less than 120 over 80, so it's a little high. I also did a physical at that time and we did some blood work. As you can see here on the left bottom screen, it's a cholesterol panel and my total cholesterol was okay. It was around 193. It should be less than 200, which was okay. But the LDL or the bad cholesterol was 118. That generally should be less than 100. You can also see here on the in the middle part of the screen, my A1C was at 5.8%. 5.8% and an A1C. A1C is how well our body handles sugar and is what we use in the medical world to determine if someone's diabetic, pre-diabetic, or otherwise. So based on my level at this time, I was considered pre-diabetic. And then when you look at the other labs here, most notably, there's two levels, ALT and AST. They both were high. Those levels give us information about the liver. So whenever we see a little bit elevated liver enzymes, especially at this level, it can mean a bunch of different things, but my workup concluded that I had fatty liver disease. So fatty liver, pre-diabetic, high cholesterol, back pain, and mildly elevated blood pressure in the Black women. And this is something that I see all the time, over and over and over again. And I knew at that minute I had to do something different. I had to start listening to the things that I was telling my patients to do so that I could live and continue to take care of my patients, take care of my family. So what I started to do was make some changes. The first thing I did was I said, okay, exercise is no longer an option. It's something that I need to do. Some people say, I didn't have time to work out. I didn't have time to do this. But I ask yourself the question, did you brush your teeth? Did you take a shower? These are all things that you had to do. And that's the same thing with exercise. So I committed to exercise. I changed my diet up a bit, stopped eating the processed foods. I think the most important thing that I did was also reduce my stress load. There was a lot of stress going on, and we can get into this as we go through the questions, but stress definitely will cause you to keep as much fat as possible. We can go to the next slide.
Okay.
And then this is after my changes. So after about a year of consistency, a lot of people think that they have to go to a gym to work out. And if you're a person that needs to be in a gym, by all means, great, get it done. But don't knock home workouts too. I personally work out at home because I just don't have time to get my kids out, get to a gym. I waste a lot of time trying to drive to and from a gym. So I created myself a space in my home so that I could be accountable to myself. So this is after me working out for a good year, 4 times a week, mostly doing some strength training. And as you can see in the blood work here, the bad cholesterol or the LDL went down a little bit to 106, which is great. And as you can see, the other thing I didn't tell you about, but there's an HDL, which is the good cholesterol that actually helps absorb the bad cholesterol. And it's also one of the things that in women, before we hit menopause, estrogen helps to keep that level up so that the bad cholesterol gets absorbed. Exercise actually helps that HDL, good cholesterol, go up. As you can also see, my blood pressure went down to a more normal range. And then the A1C, when I was pre-diabetic, is no longer in the pre-diabetic status. And then as you can see on the liver part of it that was done back in February, the liver enzymes also started to go down because the weight was starting to come down. So still some work to do, still a work in progress like most people, but the consistency is really what's going to keep it going. So I wanted to share my story because I feel like I'm very transparent and I want you to know everybody's struggling with something. This is a hard thing that we're doing and it's a choice that we make to continue to get our health on track. And this is me doing this without medication, not knocking any medication, but I think trying to get a consistent lifestyle piece in first with vitamin supplementation is really what got me here.
That part. Okay. So now we're about to get into the questions. Like I said, she has her own personal experience that she has been through, as well as she has the medical information as well. So sh I'm just speechless. So first question. So first question is, how do weight management and nutrition specifically impact Black women in the Black community?
Yeah, so this is an excellent question. So, in terms of Black women, I call it Black women having something called the Black tax on us. Like we have all these obligations, we have more stress. A lot of us, unfortunately, live in areas where we aren't exposed to a lot of different, we call them food deserts, where there's not a lot of options for fresh, healthy foods.
Mhm.
If you notice, a lot of urban areas are more saturated with where most Black people tend to stay, and not everywhere, but in majority of situations, urban areas are going to be saturated with lots of processed foods, fast foods, and so your options to get something good are low. I grew up in Detroit. Where I grew up at, there weren't very many fresh markets to choose from. And in fact, you might go to a gas station, they might have some bananas, but the banana's like $3. Who can afford that? So yeah, so between that and I also think that we're disproportionately affected by having higher cortisol levels. Our stress are very, very high. So whenever our cortisol or stress levels are very, very high, we're going to hang on to fat because going back to like prehistoric times, when you're stressed, your body perceives that as a fighter, there's no food anywhere. I don't know when the next meal is going to come. So when I'm in a stressed state, I'm going to hang on to everything because your body thinks that it's back in those times when a lot of our stress is a lot of socioeconomic and political things, whatever have you going on in the world.
That's so interesting because when you're stressed, you're trying to also, you're also like some people when they do, like when they stress. For me personally, I eat when I stress. I know it's not good, but I eat really bad when I'm stressed. So imagine eating really like eating not the best when you're stressed. And then also your body's just holding on to like your fat, like, okay, you're stressed. So that's just like double. It's like double fighting against you.
It is. It really,
Oh,
and I'm so happy you said that, Jess, because I was a stress eater. In fact, my drug of choice was Oreos. When I was stressed, I could literally, in that picture I showed you guys, I could go through an entire pack of Oreos, and that was my stress. And I thought to myself, well, I'm not drinking, I'm not doing drugs, so I guess Oreo, no, not at all. And so what I found to kind of help myself get out of that stress eating phase, there's something about verbally saying you're not hungry out loud. So when you're in a stressful situation, you tell yourself out loud, I'm not hungry. I'm not hungry. This is stress. Something about saying it tells your brain, oh, you're not hungry. And then what I started to do was find other things that my body can reflexively desire in those stressful times. So things like adult coloring. I got me a really cute coloring book, with a lot of little girls, Barbies, whatever have you. Got a plethora of color pencils, markers, and
Mhm.
I really, whenever I felt that stress signal coming, I grabbed my coloring pencils and I made my mind shift to coloring instead of those Oreos. So verbalize it and create a plan for when you're stressed out.
Oh my gosh. No. Okay, I have to verbally say I'm not hungry because you know you're not hungry. It's just either boredom, number one, or it's because you're just stressed, number two.
Exactly.
Literally, Oreos are also, someone said in the chat, Oreos are like, they keep eating Oreos and they try to tell themselves like it's vegan, so it's still not.
Exactly. But three Oreos have 160 calories, girl.
And it's
Three.
small.
And they're small. And who can eat three Oreos? You're eating at
Like,
least
I
10.
take the whole row.
Exactly.
Take it. My gosh. Okay. So next question is, what's the best way to ease into a workout plan after recovering from any type of surgery, knee surgery, any type of surgery in general? And is weightlifting a safe and effective option for someone with arthritis? Also, what strategies would you recommend for managing weight? So this is a really heavy question, so take your time.
We gonna break it down. So I'm gonna do the first part. So after knee surgery, you want to try to first off get clearance from your surgeon that you can work out. You don't want to work out too soon. Sometimes knee surgeries can be complex, and some people might need more time to adjust after a knee repair. But I always tell people low impact activities. Swim. My son's in swim. Swim is amazing for your cardiovascular system and it's a great strength training activity, and you're not pounding on your joints because you're, underwater. So swimming is amazing. Tai Chi, yoga, chair yoga. So you want to try to do more. Pilates is also okay too. You want to try to do more low impact activities as you progress through your healing phase of your knee surgery. And in terms of weightlifting being safe for someone with arthritis, absolutely. So here's the thing, arthritis, and we're talking about osteoarthritis because there's two different types of arthritis. You have rheumatoid, which is a autoimmune type of arthritis, and then you have what we call wear and tear or aging arthritis or osteoarthritis. So I'm going to speak to the osteoarthritis because rheumatoid is its own different beast. But in terms of osteoarthritis, which is your wear and tear type, if you can imagine, arthritis is how I like to say it, when people are a little overweight, the body feels weight as pressure. So if you can imagine your knees, that's probably the most common affected joint between the knees and the back. So if you can imagine your knees having arthritis, your knees actually feel, the knee joint feels excess weight as pressure. That pressure then degrades the joints, worsening arthritis. So that's why when you come to like a doctor, for example, and we say, hey, I have arthritis, what can I do? We'll say, hey, why don't you go ahead and um, try some physical therapy. And the idea behind the physical therapy is that you're going to strengthen those muscles to help support those arthritic joints. So if you have knee arthritis, focusing on more quad and hamstring strength training activities to help
Mhm.
support that knee joint itself. Because when the knee does all the work, arthritis progresses more. Same with the back. And then what are some strategies I would recommend to manage weight? So here's the thing about weight. A lot of people think that being overweight is due to a person overeating. We know that's not true. There are people who overeat, don't get me wrong. There are people who choose not the best things to eat too that contributes to weight. There are all other medical conditions that can also lead to people being overweight too. So I always say if you are in a situation where you are tracking your calories, you're eating whole foods. I'm not really a person that tells a person only eat 1,800 calories. Try to eat whole foods and portion your plate out. Whole foods meaning things on the aisles of the aisles in the grocery store, things that come in packages or bags or have a shelf life. Those are processed foods. Those are not whole foods. Your food should expire. That is real food. So
Mhm.
eating your lean protein, your leafy green vegetables, sticking to a diet with nutrient-based foods, and then also trying to get the exercise going. If you found that you're doing those things and the weight is still not going anywhere, it's time to talk to the doctor about potentially a medication strategy. And it's nothing wrong with trying a medication to help to lose weight too.
Oh, wow. Okay. Oh, okay. This is some good stuff. This is some good stuff for real. All right. Next question. Actually, I just never knew that. Like, I think it's just making sure just your overall, just like as your every part of your body supports another part of your body. And that just takes the
Exactly.
load in general from the certain areas that are a little bit more painful due to certain things. Hey, good information. Next question is, what is a good fitness routine for older women to support healthy aging and weight management?
So similar to what I was talking about with the lower impact activities, don't get me wrong, I have some older women who are patients who are beasts who can outlift me. So don't let age deter you from getting in there and going hard. I think making sure you talk to your doctor first, making sure that you're clear to do things because there are other conditions that may limit you from doing heavy lifting and things like that. But I think if you can strength train. I think as women we get so focused on cardio,
Mm.
and cardio is great. Cardio, if you can imagine, the first 30 minutes, let's say you're on a treadmill, because I have ladies I see and they say, I run on the treadmill every day for 30 minutes. So 30 minutes on the treadmill, fat, or excuse me, glucose, which is sugar, actually has a storage form called glycogen, and
Mm.
that's what stores in the liver. So when you run for about 30 minutes, you're only burning your glycogen stores. You're not necessarily burning fat. The idea behind strength training is that you're building muscle.
Mhm.
Muscle is extremely metabolically active, meaning it's going to continue to burn fat as you progress through the day because the muscle is breaking down, rebuilding itself. And that's how you burn fat. So that's why you want to mix strength training along with cardio, doing more strength training than cardio, in my opinion.
Oh, wow. Okay. Okay, got it. I did get a question in the chat. Someone did ask if your doctor prescribes a medication to help with weight loss, how long should you be on it?
So it definitely depends on the medication. A lot of the newer medications, like the injection medications that are all in the market right now, the Wegovy's, the Zepbounds, all of those, when you look at the studies that those medications were done in, when people come off of those medications, there is a risk for weight regain. I see it all the time. I see it in people who take come off the medications, they gain a little bit back. I've seen people come off and they gain all of it back. So it definitely depends on your situation and what medication you're on. There are other medications that we use, like for example, phentermine, which sometimes I might give in a short term, just to kind of get someone started. But it definitely depends on your situation and what's bringing you to the obesity table in the first place.
Yeah, because also I was always told that I was like overweight or obese, but I was also someone that had a lot of muscle as well. And I'm also tall. I'm also taller than like the average like height as well. So people would look at me, they'll be like, "Oh, you don't look like you're this much." And I'm like, "No, I am." And the doctors would always tell me I'm overweight and I do this and I do that. And I'd be like, "I don't know what else I can do because I'm trying, but physically I don't look, it's just based on the numbers as well."
Exactly. And you bring up a good point. In medicine, we use the BMI schedule. And if you look at the BMI chart, BMI wasn't studied in Black people because, like you said, you have more muscle. So we're not looking at the muscle mass. I think a more adequate reflection of weight assessment is really the fat around your stomach. So get a tape measure,
Mhm.
measure your circumference around your belly, and theoretically that should be less than 35 centimeters. That is where you should focus at. The other thing you should focus too is like I showed you guys my lab results. So if you look at me, I'm 6 feet. I'm 6 feet, and by BMI scale, I'm considered obese.
Mhm.
I have other people who have the same profile as me, but they don't have prediabetes. They don't have the fatty liver. So I think when we talk about weight and weight reduction and a plan for that, it definitely depends on what your whole metabolic profile looks like. For me, I have to lose another 20 pounds to keep my liver enzymes down. I have other people who are in the same situation as me demographically, but they don't have any of those conditions. So trying to race a number on a scale doesn't make a whole heck of a lot of sense. And it's also about how you feel. Sometimes some people, if they gain 15 extra pounds, it's causing their blood pressure to go up. It's causing them to feel bad. So it also depends on where your starting point is.
Got it. Okay. Good information. Good information. I've seen a lot of people in the chat saying same for me and when it comes to height and weight comparison as well. So see it a lot in a lot of different people. And somebody also asked, what is a good way to get weight off if you have PCOS?
Yeah, so PCOS, my goodness. So we have a talk coming up on that, Jess. But PCOS is gonna keep that. It's a lot of metabolic things that we're gonna talk about next month. Tune in, y'all. And what happens is that the body hormonally is literally making you keep weight on, with the caveat that there are different forms and variations of PCOS too. But what I find is we have a product called inositol, which that's helpful in terms of regulating insulin. And then also CoQ10 is really, really good. We also have our PCOS relief vitamin too. That's going to also help with that weight transition. And then from the medical side of it, I find the best benefit with my patients who struggle with weight with PCOS are going to be the Wegovy and the Zepbounds. So those GLP-1 medications are really good in terms of getting weight down in people with PCOS. And also there's bariatric surgery too. Don't be scared if you're struggling, you can't get that weight down. Go talk to a bariatric surgeon about getting a sleeve or a Roux-en-Y or whatever have you, because that those hormones make you hang on to every single piece of fat.
Actually never knew that at all. Like at all. Also, as you guys are coming in, make sure you guys mute so you can hear everything that Dr. Standifer is saying because this is some really good information. And she did give y'all a sneak peek of what's happening next month. Next month, just a little sneak peek into our Black History Month campaign. We're going to be all about wellness, physical wellness, just conversations about wellness. So I want y'all to get ready, be in tune. It's going to be super exciting. We're going to have events happening every single week. Okay. So get ready, y'all. Get ready. So next question is, why does it seem harder to keep weight off as we age? And are there factors beyond a slowing metabolism? Because I would always hear, oh, because I'm like, as you're getting older, your metabolism gets slower. And I would hear that just from different people all over. So what's your thought?
Definitely. So this goes along with that metabolically active piece I was telling you about. So just because you age doesn't mean that your metabolism has to slow, doesn't mean you have to gain weight. Some things slowly start to happen. As you age, you start to lose muscle mass naturally. It's called sarcopenia. So making sure that you keep up with protein. I usually say about 1.5 to 2 grams of protein per kilogram of weight. So you'll want to, for example, step on a scale, get your weight in pounds, convert that to kilograms. Now, I'm saying this to people, be mindful, talk to your doctor first, because there's other conditions that prohibit you from taking in excess protein. But generally speaking, as you age, you need that protein store to increase. And it's about 1.5 to 2 grams per kilogram of weight that you want to intake per day of protein. The other thing that you want to do too, in terms of keeping weight off, is really truly trying to build as much muscle mass as possible. The
Mhm.
more muscle mass you build, the faster the metabolism goes, which is going to be great in terms of keeping weight off and maintaining. So if you can imagine, if you can think about, I don't know, Serena, for example, she's just a walking muscle. So she just walks and she's probably burning 2,000 calories just because of her muscles being so active. So the idea is that you really want to not look like the Rock or anything, but you want to build up as much muscle as possible
Got it.
so that the weight can come off.
And I do see it. I hear this a lot because I was actually I was actually working out with my friend. And as we're working out, she was like, I don't want to lift all this weight because I don't want to look like bulky. And I think that's always like a fear of women is that as you lift weights or as you're weightlifting, you're gonna get bulky because it's as if like also the fat on you is gonna stay, plus the muscle on you is gonna stay. So it's gonna make you look very like broad. And I've heard this so many times, so many times.
And it's so not true. I mean, you have people who literally go and they focus on bodybuilding. That's a whole separate segment. But like, no, you won't become bulky if you start strength training. It's actually the absolute best thing you can do for yourself, especially going through menopause. So I think we have a question coming up on that, but you need to strength train. You have to.
Yeah, see, make sure y'all strength train. And I feel like we'll get into this question, but somebody did talk about GLP-1. I've seen that a lot on TikTok and how like I think, yeah, I think I've seen that a lot on TikTok. It's kind of like the natural, what they say, the natural Ozempic.
Mhm.
So, kind of like your thoughts on that as well, because I do see a lot of questions about GLP-1.
Yeah, you want me to get into that now? So we can talk about GLP-1 and what it is. So GLP-1 is a natural peptide that all of our bodies have. And I'm gonna get real academic because I'm a professor, y'all. So when you eat food in your stomach transmits the food to your small intestine. Your small intestine releases GLP-1. And all of us, we all do it. GLP-1, which is glucagon-like peptide 1, goes to the brain. It tells your brain you're not hungry anymore. It also goes to the rest of your digestive tract and slows digestion. This is a natural process that happens in everybody.
Mhm.
It only lasts, though, in the average person around 3 to 5 seconds, though. The medications that we're giving are working on this exact same pathway. So a lot of people I have on these medications will tell me things like, it's a brain drug. I don't have food noise. I don't think about food. I don't desire food. I forgot to eat all day. That's a thing that I hear all the time on these medications because if you can imagine you're going from taking a hormone that lasts only a couple seconds to now a week because you take the medication every week. And this is how the weight piece happens. Like people are eating less. They're not thinking about food. And it varies in a lot of different people. I have people who also say the medication makes them eat whole food. They have sugar aversions to on the medication. They don't want the sugar. The sugar is too much. The alcohol is too much. Like so much so now we are looking at using these medications or some variations of them to treat tobacco cessation, substance use disorders because of the way that they work on the brain, which says a lot about obesity, which is why I was telling you guys obesity is it's a bunch of different reasons why a person is obese. Some people do eat a lot all day, but some people just don't. It's a brain disease, truly.
Speechless. Speechless. Okay, next question. How can I effectively lower cortisol levels to support better weight loss results? And I did see somebody ask this also in the chat, and I wanted to wait because we actually had this question on our list of questions. So go ahead, Dr. Stanford.
Yes, so definitely depends on why the cholesterol levels are high. That's number one. Number two, cortisol is a stress hormone. So the first thing you have to ask yourself is, what are my stressors? There are stressors in our lives that we can control. There are stressors that we can't control. So, making sure that you yourself in life are controlling your stressors to also lower your cholesterol levels. Exercise can lower cholesterol levels. The other thing that we can do, if you've done all those things, there's also ashwagandha. Ashwagandha is an adaptogen, also holy basil. Those are some things that can also lower cholesterol levels too. So exercise, I think, is one of the best things you can start off doing, which is why I was saying you shower every day, you should exercise most days. That's going to help lower those cholesterol levels. In fact, I wake up every day at 5 a.m. to exercise. Yes, to lose weight, but really for my mindset. I'm
Mm-hmm.
a doctor, so I'm working literally. I just finished seeing patients all day and now I'm doing this talk, right? So I needed to calm my mind down. Exercise really helps to lower the cortisol levels from a mental standpoint too. So definitely what you're doing, your lifestyle, your stress, and if you've done all those things, the ashwagandha can help the adrenal gland, which is the gland that secretes cortisol, lowers some.
Yeah, honestly, no, that's actually very true. Because when I feel like, okay, I'm getting so many emails and I just need to walk away, I actually just go for a walk, just to walk away. Because that actually calms my brain. It just calms me down. And I'm able to just kind of like separate for that time while also getting my steps in at the same time. So,
Exactly. And
and
then make sure you get outside too. I think
yeah.
that's another thing that we don't
Hmm.
do a lot of, right? Like we're in this zone now where we have Google, we have social media, we have all these avenues that call us, right? Like, so you might finish your job, but then you take your phone and now you're on TikTok for 4 hours. So I think also getting outside, doing walks outside is going to also do wonders for your body as well.
Oh, absolutely. If I'm not outside some days, I'd be stressed.
Yes.
The next question is, I'm a 36-year-old single mom with the semi-active lifestyle, but my energy dips after a few days of taking vitamins. How can I sustain my energy levels?
I am so happy you came in with this question. And the reason is because I just saw someone with this similar situation recently. So, one, stress. Stress, you're a single mom. That's enough said right there. I'm a mom too. I get it. It's a lot. So I think making sure number one, you find time to fill your own cup, right? Like we're always pouring from these empty cups and we're like half dead, running on E, crawling to the finish line, trying to crawl to bedtime. Making sure that we have you should have at least 15 minutes of something for yourself every day to fill your own cup. That's number one. You have to fill your own cup. The other thing, a lot of people think that vitamins are the end all be all crux of it all. The reality is, and the reason why I, as an internist, am a medical advisor for a vitamin company, is because they work together. Vitamins, medicine, in certain situations have to work together. So if I was this, whoever this person is, make sure your thyroid levels are being checked. If you're having low energy and you're already supplementing with your appropriate vitamins, check a thyroid level, check what you're eating. When we eat a lot of processed foods, which I didn't even get into that part of it, when we eat a lot of processed foods, it causes inflammation. So the bloodstream, which is filled with all this junk, and the body can't process it. Inflammation will also wear you down, make cortisol levels go up as well. So making sure that you're checking what you're eating, because the vitamins need the good nutrients to work on to do the job, right? So
Mhm.
making sure your eating is good, and also making sure no other medical conditions are going on that are causing you to feel this way. The other thing too that we don't talk about a lot of is our mental health. Depression is real. And depression can look like another medical condition when it's not treated. It can make you feel tired, it can make you feel weak, and also iron levels. A lot of us are walking around low iron because we're bleeding from fibroids, tons of fibroids causing low iron. That can also make you feel tired. So definitely get a workup done to see exactly what's going on.
All right. Vitamins are not the end all be all. Always have to make sure and just check your overall health. Key thing. Okay. Next question is, how often should nutrient-dense food like fruits, vegetables, whole grains be included in a weight loss diet? And you were literally just talking about this just slightly. And so this is the opportunity to go full out.
Yes, so every day, fruits and veggies and whole grains should be in your diet every day. Try to make your plate where like half of it is leafy greens or some vegetable of the sort. If you're a meat eater, lean white meat is best. People sleep on tofu. Tofu is pretty good. You season it up right, very good, high in protein, has a ton of nutrients and vitamins in it. And then also making sure that certain fruits too, right? I know a lot of people like my kids love grapes. They love all the like sweet types of fruits. But also remember, fruit, as good as it is, in excess can cause some weight changes too because it's sugar, it breaks down to sugar. My favorite fruit to eat that is actually really good for the heart is actually blueberries. I think everybody should eat at least 10 or so blueberries a day.
Hmm.
Blueberries, all of your berries, like blueberries, raspberries, but blueberries are my favorite. And I think the antioxidants in them actually also help aid in overall health too.
I love me some blackberries. And I've realized that like the fruits that are always sweeter, those are the ones that like people just tend to like more, but those are also the ones that are high in sugar. So it's
It
like,
is. The other thing too, just I wanted to say, and I talked about this a little bit before on one of the other webinars, but they're now in medicine, right? It's 2025. We have all this new fancy high-tech stuff. So
mhm.
when we treat people with diabetes, there's now a monitor you can wear called a continuous glucose monitor. The ones more popular ones are Dexcom and Libre. And what they do is you wear them on your arm and they continuously measure your sugar constantly. Now there's a new one out called Stella. We don't have any relationship with this team, but I think it's something to look into if you're just trying to struggle on what to eat and what things affect your body. I wore one for a while, and what I found was things that I thought would cause my sugar to go up, for example, didn't. So, for example, I wore it. I love pancakes. I love syrup. So one day I said, okay, I'm just going to eat whatever I want to eat and let me just see what my body does to this. Now, as a doctor, I might tell somebody, hey, try to limit your pancake intake, try to limit your carbs if you're trying to lose weight. That's something that most people might think or say. So I go, I have this monitor on, I'm eating these pancakes with this syrup. My blood sugar did not change. It did not change. I had one on my husband, his shot up.
Oh,
Okay. So I say that to say as we're learning more data, care should be individualized. So different foods can make different people's sugars go up, go down, whatever have you. What I did find was that my blood sugar went up with Pepsi. I drank 7 ounces of Pepsi, probably about this much Pepsi in this bottle. You guys can see this.
mhm.
And drank that much Pepsi, and my sugar shot up to almost 300 just with that amount of Pepsi. So
Oh,
it taught me what food specifically I should stay away from, more than just a guess like, oh, you should do this, or you actually will learn what your body does. So that's something else to consider if you're struggling with weight and what you should and shouldn't eat.
got it. And then also, I did want to ask, what fruits do you recommend that aren't as high, like besides the berries that you kind of recommend? Because I've heard like the phrase, an apple a day keeps the doctor away. So,
Yeah, so yep. Apples are high in fiber. We love apples.
mhm,
Plums, and like I said, I found that in some people the sugar jumps up with plums, some doesn't.
mhm,
Bananas are really good. I think it's again all about what things are going to make your sugar rise up. But your bananas, your blueberries, your raspberries, certain melons, guava fruit does a pretty good job of not raising it too.
got it. Okay. Never had a guava before. Actually, I had guava juice, but haven't had a guava. Gonna try that. Next questions are, what are your thoughts on fasting? What supplements should I take while fasting, whether intermittently or for spiritual purposes?
So I think for the right person, fasting is great. Like I have people who fast. If you look at some of the studies that were done on weight loss, some doctors actually treat diabetes with fasting. Because if you can imagine, so if we again go into my professor hat now, if we can imagine we have insulin and insulin levels are always at a low threshold in all of us. We call it fasting insulin levels. Some
Mhm.
people's insulin levels can go up. So when we fast or don't take in food, that can cause the insulin levels to come down, which can aid in weight loss. So I think fasting for the right person is a good thing. I do think that when people eat late, so if you're eating dinner after 6 and 7 o'clock, we do know that that has been shown to cause more weight gain. So in terms of fasting, I would say if you can't go the whole, some people might say I don't eat until 12. My eating window is from 12 to 8. I think it just depends on your body. I have some people who just cannot go a full day without eating. Me, I lift heavy most days. So when you lift weights and when you start to get into the exercise program, you'll find your hunger will pick up.
Yeah.
So if you're in that cascade where you're exercising heavy, you may need to eat more to sustain your energy levels.
Mm, got
And
it.
then it says, what supplements should you take while fasting? Vitamin D is great. That's going to help with insulin regulation. We talked about inositol. That also helps with the insulin as well.
Mhm.
B12 is great. Omega 3s are great for reducing inflammation. And then also making sure you take your multivitamin.
Got
We
it.
have all those, Jess,
We do.
right?
Yep.
Yeah, we do.
Yeah. So I somebody did ask, what's your thoughts on juicing?
I think juice is great. I mean, it can get expensive because you got to juice 12,000 pieces of fruit to get this little thing. For me, just give me the apple. I'm just, but I think if you got it to do, why not?
Right? No, it's true. I've when I started juicing just for like a week. Oh my gosh, I'm like, this is all the fruit I'm buying, and this is only for like 3 cups, and that's it.
But I think it's great, especially if you're like, for me, I don't like bananas, but I
Mm.
know I need a banana here or there. So I'll throw that in some juice and blend it up. But I think a lot of people go out and they spend hundreds of dollars on juicing and then they're like, well, now I don't have enough money to get the other things I should be eating. So I think it also depends on where you are in your situation too.
It's all about balance. I think that's
All about balance.
balance. So next question is, I'm just starting my weight loss journey. What supplements should I consider adding to my routine? What vitamins or supplements do you recommend to aid in weight loss and energy balance?
Yep, and I think we answered some of those in the
Okay.
last question, but your vitamin D, D3, your omega-3 is great, your multivitamin. If your iron is low, make sure y'all get your iron checked. If your iron is low, or if you're in a situation where you have a period that lasts more than 7 days, if you do, please go get checked out. That could also mean your iron is low. So making sure you get your iron levels up, because if they're not, you're going to be really tired and bogged down and not be able to actually do the weight training or whatever have you to get the weight loss.
Mm, got it. Also, if you have any questions, please put them in the chat. We are going to try to answer as many as possible. So please make sure you put your questions in the chat because we're going through all the questions. Next question is, what role do vitamins like vitamin D, B12, and magnesium play in weight regulation, and how can they be incorporated into a balanced diet?
Yep, so D, like we talked about, that's going to help with some immune function, also helps insulin work a little bit better. The B12 helps with energy and metabolism. It helps with that cascade. And then magnesium also helps with metabolism as well. And it also actually helps to naturally lower cholesterol levels too, magnesium does. And then in terms of a balanced diet outside of taking them in your vitamins, uh, vitamin D you can get in fish, you can get in some of your oils. It comes in eggs. B12 is going to come in, it's mostly in some of your red meat. You can also get it in your leafy greens. And then magnesium. So magnesium is the problem here because theoretically we would get our magnesium from a lot of our fruits and veggies. But
Mm,
magnesium, the fruits and veggies actually have to hang on the vines and stems long enough for the magnesium to get into the fruit and veggie. The problem in America, a lot of our fruits and vegetables are not being harvested for nutrition, they're being harvested for financial gain. So the magnesium levels in a lot of people are low, which is why I do ask people to get those checked for supplementation reasons.
got it. Got it. I did see a question about sleep and how does sleep relate to just your weight and just kind of like gaining weight and just like weight loss.
Y'all, sleep is critical. I know it's goofy because they'll tell you, live your best life, enjoy all your moments, live hard, go hard, apply pressure, all this stuff. And then you look up and you only sleep for 4 hours a night, right? So prioritizing sleep because sleep is going to actually help the brain reset, the body reset. It's also going to help lower those cholesterol levels. So when I was in residency, that's the picture that y'all saw was I was much, much bigger. My cortisol was higher too because I wasn't sleeping. I was working 30-hour shifts in the hospital. So sleep is critical. It's critical.
Sleep is critical because I used to think like it was okay, like especially when I was in college. Oh my gosh, when I was in undergrad, I literally could not. I was barely getting any sleep. So, and then it's like, okay, I was also stress eating. That's another thing. I was also stress eating. And then I was also just not being active as well. So it's just so many different variations, different factors. And especially me not sleeping, I probably was sleeping maybe 3, 4, 5 hours, maybe 3 or 4 hours a day just by studying and working and everything like that. So it's kind of like, how do I keep up? Like, what do I need to do to keep up?
And that's the biggest thing people deal with too. How do I sleep? I think somebody asked this question, like, what if I can't sleep?
Yeah.
So the other thing is like, that's why I love exercise. It literally calms your mind down. That's the first thing. When you come to the doctor, we're always like, what's your sleep hygiene schedule look like? Are you sleeping? Are you scrolling? You shouldn't be scrolling on your phone an hour before bed. You shouldn't. And let's be honest, most of us do. The
Hmm.
other thing, menopause. Menopause is going to affect your sleep between hot flashes, night sweats, whatever have you. You might have some trouble sleeping. So, magnesium is also really good to take at night to help sleep. Melatonin is also great. Some people need a little bit of a cannabinoid. Talk to your doctor first about that to help sleep. And the other thing that people don't realize too, anxiety.
Mm.
Anxiety in the Black woman is keeping us awake at night.
Yeah.
Some of us with that go hard, apply pressure, go hard, go hard, go hard. A lot of us are finally getting to lay down and stop when we get into bed. That's our first time we get a break from the day. And so what happens when you finally get to rest and reset? Your mind starts thinking about all these things. What about this? Then the next week, practice next week. Husband trying to tap you or partner trying to tap you, trying to have sex. You don't have nothing to give to nobody. Like it's all anxiety will make you stay awake. And it's something that we don't talk about enough. We don't. We suffer in silence. We're drinking too much caffeine and just push through the day. And then this is what we have.
My God. Oh my God, there's so many aspects, but it's really just about just making sure you're good overall. Like that's the key thing I'm getting from this. It's just making sure you take care of yourself overall, from internally, externally. Everything counts, everything makes sense, everything just connects with everything else. And I did see another question, just kind of like menopause and how menopause affects with like weight loss as well. And I feel like we touched on that a little bit, but if you want to talk about that as well, menopause.
Yep, we did. So menopause again is when your estrogen levels are declining naturally just from the phase of life that you are in, going from a reproductive life to a non-reproductive life. And that estrogen decline is what's going to cause some of that metabolism to slow. It's going to also cause you to gain more fat in certain places because fat is actually a source of estrogen. So your body wants to make fat because it's trying to also compensate for lack of estrogen. But again, going and doing that strength training is going to be king. We also have Minochill too, which also helps those menopausal symptoms too. It has ashwagandha in it, so also helps with the sleep part and the stress levels.
That I think like what? What?
I
What?
know. I know. Why do we have it so hard? That's the question.
What?
Like, why do we have it
What?
so hard?
Oh my gosh.
Yes.
Oh my gosh. Okay, somebody else also asked, because you see a lot of people talking about apple cider vinegar and also just like controlling weight. Like, what are your thoughts on apple cider vinegar as well?
Apple cider vinegar can be helpful. And again, I think it just depends on the person and the reason why you're obese in the first place. Um, Try it out. Is not a harm to try it out, but I have people who get success on it, I have people who do not. So it's not like a sure and shooting thing.
Okay, got it, got it. And I think I did see things about like teas for helping with like when you're hungry, drinking teas. Like, okay, I'm hungry. I'm gonna drink some tea just to help like ooze the hunger or ease the hunger. Like, what are your thoughts on that as well?
So depends on the tea. Like some of the teas, like the green teas and the black teas that have the caffeine in it, those are appetite suppressants just naturally too. Definitely depends on the tea. I also think it's a great idea to start your day with a little bit of tea or something hot just to kind of let the body settle in as well.
Got it. Okay, well, just looking at other questions as well, like if you have any questions. Oh, somebody did ask, is there such thing as eating for your blood type? I did hear that, and I've heard that before. Like according to your blood type, you have to know what you're eating and things like that. Is that such a thing?
So in what do we say? In the naturopathic world, there have been some studies that suggested that there is a blood type, this idea behind eating for your blood type. I personally haven't seen any like, so as I'm an MD, so I like to look for randomized controlled trials to know definitively what things will show. I think it's all about what works for you. If you get your blood type checked and you want to eat for your blood type and it works for you, great. I think that's the biggest thing. It's not a one size fits all in medicine. We're all different, which is why I brought up the Stella, which is why I brought up understanding what different things and knowing why you're obese in the first place.
Hmm. That's the key thing. And then somebody did ask about chair yoga and how does chair yoga just can chair yoga help like with strength training or just kind of like your overall health as well?
Definitely. I love it, especially for my seniors. I have patients who are in wheelchairs that can't do a lot of getting up. Go on YouTube, y'all. Go on YouTube. It's a ton of people on there giving free yoga classes, YouTube chair yoga, and get it going. Why not?
YouTube University is a thing. And
YouTube University is a thing.
genuinely
TikTok
right.
University, all of that. Yes.
TikTok University, honestly, those are things. I definitely get all of my information from there as well. No, this was some good information, y'all. This is definitely being recorded and it'll be up on our YouTube page very, very soon. I love our talk to Dr. Standifer because she really just gets real. She talks about her. I think the best thing with that, she talked about her personal experience as well, like how she was able to just change just the things that she did just to just change her life and just you'll see it internally as well. So I Definitely appreciate that from you, Dr. Standifer. We love Dr. Standifer. We definitely do. So yes, I just
I love y'all too. And I'm so happy we doing this because in the primary care world, y'all, I wish I can sit and talk to every patient for like an hour like this. I really do, because this is what people need. So I'm so happy we have at least this platform so we can at least get some information out the best we can.
definitely, and I'm so happy that y'all came on Wednesday also.
Let's
Because
get
we were
it for
like,
the
let's
Wednesday
do it on
crew.
Wednesday. So let's see, we usually do it on the weekend, but like let's do it on a Wednesday. So yes, the recording will definitely be shared. We do have a special discount for you. Transform 24 hours only, y'all. So you have it between now and tomorrow. So make sure that you guys have all of that. And yes, I just want to say thank y'all again. And also, like Dr. Standifer said, next month we have so much information, so many webinars. One webinar, we are talking about PCOS, y'all, and I know y'all have been waiting for that. And we got Dr. Standifer with us talking about that. So she's going to give us all the details. So all the questions y'all have about PCOS, she will answer them next month. So make sure you guys have your eyes open. Make sure y'all subscribe to our emails. Make sure y'all put notifications on our emails as well, because we will have all the information that's needed, or we'll give you guys all the information that's needed for next month's webinar, Black History Month, just everything, okay? Because we have been planning, we have been planning. But I just want to say thank y'all. Thank you so much, Dr. Standifer. Thank y'all, everybody, for coming. We really appreciate it. And yes, make sure you guys use the code, and we will talk to you guys later next month. Actually, talk to y'all next month. So yes, bye guys. Thank y'all so much again.